Hi, I'm Glenn Williams, Vice President and Group Editor of Neurology Reviews. I'm in San Diego reporting from the 65th annual meeting of the American Academy of Neurology, and I'm joined by Dr. Tobias Kurth, who presented some interesting research on women with migraine with aura. Dr. Kurth, please tell us where you're from and what findings you presented at this meeting.
Hello, I'm currently working in Bordeaux. I'm a neuroepidemiologist, so we conduct studies in the general population. I do mainly my work on migraine and consequences of migraine. I also have an affiliation at Boston Brigham and Women's Hospital as well as Harvard Medical School, but my main work these days is in France.
Can you give us a little summary of the findings that you presented at this meeting?
Yeah, sorry. The data that we looked at were data from the Women's Health Study, which we have used several times now to evaluate risk of cardiovascular disease and stroke in women with migraine with aura, migraine without aura, and women who did not report migraines. And in this particular study, we looked at the relative contributions of migraine with aura to other cardiovascular risk factors on the occurrence of major cardiovascular disease in women. And we found that migraineurs with aura have a strong increased risk in major cardiovascular disease. And quite surprisingly, that risk holds up to other major cardiovascular risk factors such as smoking, having a history of diabetes, or being morbidly obese.
Okay, thank you. A couple of questions. Were you surprised that migraine with aura was a greater risk factor for cardiovascular disease than smoking, a traditional risk factor?
I was surprised how robust the data are. I mean, I'm working with the data since quite some time, so I know that migraine with aura is a pretty strong marker for increased risk of cardiovascular disease. But to really run this model and directly compare migraine with aura to other major cardiovascular risk factors, I was really indeed surprised that it was really ranked such a strong position and was the second strongest single relative contributor to major cardiovascular disease. So I was indeed a bit surprised, yes.
Okay, thank you. Do you have any idea what it is about migraine with aura that causes this risk?
This is an excellent question, and we're trying to figure out what it is really. Is it the aura? Is it something about the migraine that's causing it? There are some theories about this. For example, there's an endovascular dysfunction that's been described for migraines with aura, inflammation processes, genetic markers, other diseases that may cause both migraine and cardiovascular disease. But we don't know for sure what of these factors actually are driving this, or if there are other factors that are involved. So we are looking for new data. We try and set up new studies to really understand the mechanism why migraines with aura actually have this increased risk.
Okay, thank you. So this was just in migraine with aura. Was there any single signal in women with migraine without aura or in men?
Yeah, I think the best data is from women with migraine without aura, because this is the larger group, and we didn't find anything in the past that linked that group with an increased risk of cardiovascular disease, including stroke, myocardial infarction, and others. In men, we actually have shown that men with migraine also have increased risk for stroke and cardiovascular disease. The issue with migraine is that it's less common in men. So this is one of the few circumstances in research where men are understudied, because we just don't have enough men with migraine in our population samples that we're looking at to really estimate this well. There was one study we did, I was involved in. It's not this study I'm presenting here, but it showed similar association patterns than in women, so I believe there's no gender difference.
In your study, the migraine was self-reported. What percentage of patients would you think really didn't have migraine?
It's another good question. In population samples, as we work in, we need to rely on what people tell us, and of course it's not always true. So if people report to have migraine, sometimes that's not really migraine. They may have other headache forms, such as a severe tension type headache or other headache forms. It's very difficult to say. We don't have good data how many of the women reporting migraine really didn't have migraine. But I would say that the vast majority of those really have migraine. The reason why I'm saying is because our estimates of migraine is pretty much similar to other big population-based studies. So we're right on target there. The other good question, of course, is with aura. How do we distinguish aura? And that's something which is extremely difficult to do, and we certainly have a crude measure there. But nevertheless, I also think that most of the women reporting migraine with aura actually do have aura features.
Okay, thanks. I guess finally, one last question. What should treating doctors do to prevent stroke and myocardial infarction in these vulnerable women?
Well, it is, of course, an excellent, very important question, what should be done. First of all, we need to understand that not everybody with migraine with aura is getting a stroke or a heart attack or cardiovascular disease events. It's still a minority of these women. We need to understand mechanisms before we can give any specific recommendation. There is currently no data to show that modifying migraine, preventing migraine, reduces the risk of cardiovascular disease for these women. So the current recommendation is to modify risk factors that we know have a big influence on cardiovascular disease. So if you have hypertension, treat hypertension. If you smoke, stop smoking. If you have diabetes, treat diabetes, and so on. And in the future, hopefully, we have more data to really say what precisely women with migraine in addition can do. I would say that the important message from our data is really that we have information of a risk marker. So that's a good thing. If you have migraine with aura, then you may be at increased risk for cardiovascular disease, so you know that already. And our study had a 15-year follow-up, so it's not like when you have a migraine attack right now, you get a cardiovascular disease event tomorrow. So that may be within 15 years, at least in our data. So when I know early enough that you are somebody who is at increased risk, I can actually modify risk factors. And by that, simply change of lifestyle, treating hypertension, as I said, you may be modifying your risk of cardiovascular disease. So it's not just a negative thing that if you have migraine with aura, oh my God, I'm at increased risk for cardiovascular disease. Physicians and patients should also think that's a good thing to know something a little bit more advanced, and they can react accordingly. But there is no specific, as of today, that can be recommended for patients with migraine with aura, other than the general recommendations to reduce the risk for cardiovascular disease.
Okay, well, thank you very much. Thank you for your time.
Thank you very much.
Thanks.